The silent bone disease many seniors don't know they have. Have you ever wondered why some older adults seem perfectly fine one moment, and then suddenly suffer a serious fracture from something as simple as a small fall? Not a major accident, not a heavy impact, just a simple slip, or even a cough in some cases. What if I told you this is not bad luck? It could be a silent disease slowly weakening the bones over many years without any obvious warning signs. Welcome to My Emerald Health. Today we're uncovering something many people only discover too late, a condition that quietly steals bone strength until the bones become fragile, brittle, and dangerously easy to break. And yes, most people don't even know they have it until damage is already done. But before we continue, if you're interested in health and wellness products that support stronger bones, better mobility, and healthy aging, you'll find recommended links in the description below and again at the end of this video. Let's begin. What is this silent bone disease? The condition we're talking about is called osteoporosis. It is often called the silent bone disease because it develops slowly, without pain, and without obvious symptoms in the early stages. In osteoporosis, bones lose density and become porous, almost like a sponge with tiny holes inside. This makes them weak, fragile, and more likely to break. To understand this better, imagine your bones are like a strong honeycomb structure. When you are young, that structure is thick and tightly packed. But as time goes on, especially with aging, poor nutrition, and hormonal changes, that structure begins to thin out. And once it weakens enough, even a simple fall can cause a fracture. Why most people never see it coming? This is where osteoporosis becomes dangerous. Unlike pain in the joints or muscles, bone loss does not shout for attention. There is no early warning pain, no swelling, no discomfort. So many people feel completely fine until suddenly something breaks. That is why doctors call it a silent condition. By the time it is discovered, bone strength may already be significantly reduced, and the most common places affected are the hips, the spine, the wrists. A hip fracture in older adults, for example, can seriously affect mobility and independence. What really happens inside the bones? Your bones are not dead structures. They are living tissue that constantly rebuilds itself. There are two key processes happening all the time: bone breakdown, removal of old bone; bone formation, creation of new bone. When you are younger, these two processes stay balanced. But as you age, especially after 50 or 60, this balance begins to shift. Bone breakdown starts happening faster than bone rebuilding, and over time, you lose more bone than you replace. This is how bone density slowly decreases. Why? Seniors are most at risk. Several factors increase the risk of osteoporosis in older adults. First, age itself plays a major role. As the body ages, it naturally produces fewer hormones that help maintain bone strength. Second, calcium absorption becomes less efficient. Even if you eat enough calcium, your body may not use it as effectively as before.
Third, physical activity often decreases with age. But bones need movement and pressure to stay strong. Without regular activity, bones weaken faster. And finally, vitamin D levels often drop, especially in people who get less sunlight. Vitamin D is essential for calcium absorption. Without it, bones lose strength even faster. The dangerous consequences. Now here's where things become serious. When osteoporosis progresses, even small everyday actions can become risky. Simple movements like bending down, lifting a light object, or tripping slightly can result in fractures. A spinal fracture may even happen silently without a major fall, leading to back pain, height loss, or a curved posture. And once a major fracture occurs in older adults, recovery can be long and complicated. In some cases, it can even affect independence and quality of life. How do you know if you are at risk? Since osteoporosis is silent, many people only find out after a fracture. But there are warning risk factors such as being over 60, family history of fractures, low calcium or vitamin D intake, lack of exercise, long-term use of certain medications, being underweight or frail. Doctors often use a scan called a bone density test to measure bone strength before fractures happen. Can you slow it down or prevent it? Yes, and this is the important part. Bone loss is not completely unavoidable. There are ways to slow it down and support stronger bones even in older age. One of the most important factors is nutrition. Calcium-rich foods like milk,
Yogurt, leafy greens, and fish help support bone structure. Vitamin D is equally important, and sunlight exposure plays a big role in maintaining healthy levels. But diet alone is not enough. The role of movement in strong bones. Bones respond to pressure. This means movement actually signals your body to strengthen bone tissue. Even simple activities like walking, light strength exercises, climbing stairs, stretching routines can help maintain bone density. In fact, inactivity is one of the fastest ways bone strength declines. The more you stay active, the more your bones are encouraged to stay strong. Protecting bones in daily life. Preventing fractures is not only about bone strength, it is also about safety. Small lifestyle adjustments can make a big difference. Keeping floors free of obstacles, wearing proper footwear, using handrails when needed, improving home lighting. These simple changes reduce the risk of falls, which is the main cause of fractures in seniors. The big picture. So what is the real message here? Osteoporosis is silent, but not invisible forever. It slowly weakens bones over time, often without warning. But awareness changes everything. Once you understand it, you can take steps to protect yourself or your loved ones. Stronger bones mean more independence, more mobility, and a better quality of life as you age. And the earlier you take action, the better the outcome. Conclusion: the silent bone disease we talked about today is more common than most people realize. But it is also manageable with the right knowledge, lifestyle, and care. Bone health is not just about age, it is about habits. Every step you take, every healthy meal, and every bit of movement contributes to stronger bones. If this video helped you understand something new, consider sharing it with someone who may need it, and also subscribe to my Emerald Health channel so as to stay updated. And don't forget, you can find recommended health and wellness products in the description and pinned comment to support better bone and joint health. Disclaimer: this video is for educational and informational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider before making any health-related decisions or changes, especially if you have existing medical conditions.